People-centered health systems should be about listening to people, patients and the caregivers, about what they want to receive in the health system, the treatment side, the psychological and social side. It's about everyone thinking about the people, thinking about the patient and how they should receive the health services, but with them having something to say at the table. I'm from Lithuania, and when I was 18, so that was nearly 9 years ago, I was diagnosed with chronic myelogenous leukemia. That is a type of rare blood cancer. Before going to sleep, I thought, I'm not sure what this diagnosis is. I know it's cancer, but does it mean that I will die? Well, probably, even if so, not so fast.
Նիկոլայը ուրեմն 3 տարեկան հասակում ինքը իր մոտ ախտորոշվել է սուր աուտիզմ։ Սկզբում խնդիրը խոսելն է եղել, հիմնականում դա խնդիրը խոսելն էր, չէր խոսում, բոլորովին այլ մարդ է, ցանկացած ծնողը որ լսում է ինձ, երեխան ծնվում է եւ իր երազանքները իր երեխայի աչքերի մեջ նայել է, երեխան խուսափում էր, գլուխը կարող էր բռնել ուղղակի ուզենալ իր աչքերին նայել, չէր նայում աչքերիդ։ Եվ մեծ ցավեր, մեծ վիշտեր, փառքաստուն, բոլոր հաջողություն բոլոր նրանց, ովքեր որ ամենաբարդ խնդիրը միջավայրի հասարակության չընկալելն է։ Երբ չեն ընկալում, որ երեխան ոչ թե ոչ լիարժեք է, այլ երեխան ինչ-որ խնդիրներ ունի, այլ աչքով նայել երբ երեխային։
I slipped and fell in my garden on the wet grass. And I knew that I had hurt myself quite a lot because I couldn't move. And I was a bit anxious. I became quite stressed because I wasn't sure if my husband was about and I couldn't see him. But I called on him and he phoned 999 and the ambulance came out within 10 minutes. They told me that they thought that I had broken my leg.
Имало е места, които нищо не ми се прави, чувствам се нервен, напрегнат, чувствам изолация, дори от близките си, изолация в обществото. Просто изпаднах в такова неадекватно състояние, не пиех лекарства, живеех като скот в един апартамент, който нямаше никакви мебели в него, нищо. Просто стигмата до такава степен обвинявах баща ми и бях към него толкова неадекватен и агресивен и се бях затворил 20 дни, бях стоял в къщи. Но такава беше стигмата, такава ми беше болестта.
People-centered health systems improve access to health and well-being. Patients and their carers have a right to participate in making decisions about the health services they receive, and people-centered health systems honor that right. These are the stories of 4 people from the WHO European region. Despite fundamental differences in the way their national health systems fund, manage, and deliver health services, these stories show that people-centered health systems are possible, even in a challenging environment.
Then I got my white blood cells back to normal around Christmas Eve. And at that time, I was again in the hospital and I was there to confirm that I will go for bone marrow transplantation. And then the doctor suddenly says, okay, we didn't find a donor for you, but we give you this modern treatment. And therefore I received these pills that I'm still taking now every day for 9 years. And so with these pills, you know, I'm able to live a normal life, have a mild side effects, but you know, I can live to the full potential. When I was receiving these pills and I was feeling very good that I'm responding to it, and I was going back to hospital every month. But I was seeing the same people every month that I was seeing before, and those people's health was deteriorating from the time I was seeing because they were not receiving that treatment. So I was one of the lucky few. And you know, it started to grow inside that I was not feeling comfortable that I'm receiving this treatment and others are not. I thought, okay, I know a couple of journalists, I know some local politicians, maybe I could spread the news around. But I thought, what can I do? Okay, I thought I would create a website. In the website I would say, state my story. I would say that I'm getting the treatment but others are not, and that's not fair. And I would open the petition. And the petition asking people to sign that they should support that the idea that the government should fund those therapies that are really efficient and are life-saving. Putting a notion that if there is a therapy and some patients can benefit from it, it would not be right if it would be just some limited lucky patients who are benefiting and others are dying. And in the next year, the government found ways to increase the funding 2 times. And they also managed to increase the funding for all the patients with another rare disease. And it went up, and by the year 2012, everyone was insured. And now the reality is that every patient in Lithuania is receiving not just this treatment if they need, but they're also receiving the treatment that works if the first one doesn't work. So the first line therapy is reimbursed, second line therapy is reimbursed, third line therapy is reimbursed as well. This is not the achievement of one person in my position. It was an achievement of society, and it was a lot of support in the society at that time.
People-centered health systems realize the importance of involving patients and carers as partners in their own care in ways that are culturally appropriate and are adapted to their circumstances.
Երեխան ընդհանրապես իրեն ներվային ագրեսիվ էր պահում եւ ծայրահեղ անհրաժեշտություններ ինչ որ մի հասկանալու, ինչ որ մի լուծում գտնելու։ Անհրաժեշտությունը դրանից էր երեխայի լեզուն հասկանալ, ուղղակի հասկանալ թե ինչ է ուզում երեխան։ Եվ հետո իր վարքի մեջ ինչպես կարելի է փոփոխություն շտկում մտցնել։ Իրեն նախապատրաստեինք, որպեսզի ընդհանուր հասարակության մեջ ինքը կարողանար գնա հաճախել ինքնուրույն դպրոց, իր դասերը պատրաստել։ Դրանից հետո դռնեդուր շատ ենք ման եկել։ Վերջը իմացել ենք, որ Գավառում նման կենտրոն կա 2 փուլով։ Ես ասում եմ հրաշք տեղի ունեցավ, որովհետև այն անհուսալի, անելանելի վիճակից, երբ որ թվում է, թե նույնիսկ Աստված չի կարող օգնել։
Սկզբում, երբ եկավ Նիկոլայը, խոսք չուներ, հաղորդակցում չկար, ոչ խոսքային հաղորդակցումն էլ էր բացակայում, վարքը ագրեսիվ էր, հաղորդակցումը դժվարացած։ Հետո արդեն սկսեցինք տառաճանաչություն, որտեղ անցած տարի աշխատել ենք տառերն ա բոլորը սովոր է, այս տարի արդեն դպրոց էր գնում, երբ դպրոց հաճախեց, արդեն գրաճանաչ էր, տառաճանաչ։
Նախ երեխային գնահատում ենք ծնողի ներկայությամբ, լսում ենք ծնողի գանգատը, ծնողին բացատրվում է երեխայի խնդիրը, դրանից հետո փոխմբռնումով է մոտենում մեր աշխատանքին ու սկսում է համագործակցել մեզ հետ։ Իսկ երբ որ կարողանում ենք արդեն շահել երեխաների վստահությունն ու սերը, աշխատանքն համեմատաբար սկսում է ավելի հեշտանալ երեխայի հետ։ Նիկոլային ասեմ, որ հայրը շատ մեծ ներդրում ունի։
People-centered health systems and services are about approaching patients with empathy and addressing them in a way that speaks to their fears and vulnerabilities.
And they took me and they put me into the ambulance and talked to me and kept me, reassuring me the whole time. It was taken straight in to the emergency department and they were all very kind and explained to me that what they were going to do. Next morning I woke up and I was told that I was going for my operation. I wasn't allowed to put my feet down for 12 weeks, I would say. They cooperated with my GP to make sure that he was aware of what was happening, and if I needed any extra pills, he organised it, and we didn't even need to go to the chemist. They delivered them to us. The cooperation between the physiotherapist and the occupational therapist we were constantly making sure that I was walking when I did start walking all right and I had no problems. And I was then taken on by another exercise group which I'm still attending, and they actually phoned me to ask me when I was going to start, and I said I didn't feel great at the moment. So they phoned me again the following week and again the following week to make sure that I was all right, and because they were cooperating with everybody else, and I was fine.
People-centered health systems extend beyond the health sector by providing options for people to re-engage with work and society in a safe environment.
Първото, което е това, че лечение с мен се провежда от доктор Александър Петров, когото аз уважавам и цена като един много почтен и с голям професионализъм човек, който си върши работата. Второто, което е, това е работата ми, която ме поддържа в тази пералня зелена. Много съм доволен от работата си, тя ме привлича, дава ми едно чувство за значимост, създава ми самочувствие, дава ми възможността социално да се включа. И третия етап, това е подкрепата, контактите, които срещам с хората в къщата. Дневният център, той не те задължава, но ти дава възможност контакта да осъществиш и то на сигурно място, където можеш да споделиш и с лекаря, да се видиш, да поговориш с твоя брат по съдба. Виждаш една сродна душа, нещо какво... Това е дневният център.
Coordinated, integrated health services that enable communication and collaboration between providers and respond to the unique circumstances of each patient are a hallmark of people-centered health systems. To be truly effective, patients' needs must be put at the heart of their health system experience.
Както едно колело, основното е лекаря, който те обгрижва. Тези колела, които са настрани ляво и дясно, представляват телефон 112, отношението с близките, с роднините, с родителите, което е много важно.
They were all so nice to me, called me by my name, Olive, and you know, made me feel that everything was under control. And because they talked to me like, "Hello, Olive, how are you doing today?" kind of thing, I was able to communicate with them so much better because they were my friends. It made me feel that I was a person to them, not just a patient. I was a person.
Էլինորից պետք է ասեմ փառք Աստծուն, աշխատանք ունենք, մենք մեզանով կարողանում ենք տեղավորել, ոչ միայն օգնությունը ես կուզենայի իմ երեխայի համար, այլ այն չարչ
I think it is very important to include the patients in the working groups that are being established and to involve the patients in representation of the permanent committees, whatever committees exist. Only through looking at different lenses you could see that you should combine the interests of all the parties. And when we're speaking about the parties, it's not just the doctors, the physicians, the industry, and the experts and academia, but it's also the people and the patients and the caregivers. It's very important. They know what is working and what is not in the system, and they can advise of how to fix those aspects and those elements that can be improved.